officials would not rule out boosting enforcement to remind travelers of the COVID-related quarantine laws. Richard Zussman, Global News, Victoria.
Albertans most at risk have started receiving the Moderna vaccine. Today, health workers took the first batch of doses to seniors' facilities. But as the vaccination drive expands, some criticism that it's not happening fast enough. Fletcher Kent explains.
Sheila was Alberta's first. After the Medicine Hat woman received Moderna's COVID-19 vaccine, more people in seniors' facilities got theirs. A relief for sure.
Thank you.
It was a milestone day in Alberta's COVID battle. As this next phase of a massive vaccination campaign begins, questions remain, though, over how we've done so far. And in the last few days, the answer seems to be, could be better.
Our direction to AHS is to treat the administration of the vaccines as an emergency.
Promises to vaccinate 29,000 healthcare workers by December 31st seem unlikely now. Data released on December 29th shows Alberta had vaccinated 6,500 people, although the province has updated those figures saying it's closer to 7,000. That puts Alberta near the bottom of the list for per capita vaccinations. And Canada lags behind other countries like the US and Israel, whose vaccination rates are respectively 4 and 39 times higher than ours.
This is not a sprint. This is going to be on the way to a marathon, because it's going to take months.
Alberta's former Chief Medical Officer of Health expects vaccination rates to get better. Dr. James Talbot was the deputy CMOH during the H1N1 pandemic and says that vaccination campaign taught him one big thing.
So the most important thing is transparency. I mean, you just need the people who are running the campaign to be just absolutely crystal clear about
Crystal clear scene from the Global News, Edmonton.
Premier Kenny vowed Alberta
December 30th of 2020.
Cabinet instructed AHS to make changes, including offering New Year's Day vaccinations.
All hands on deck, and we should be using every day, 7 days a week, to administer as many vaccines as possible.
Because firsts are great. It's the millions that follow that will really test this plan. Fletcher Kent, Global News.
As of today, Alberta has recorded more than 100,000 cases of COVID-19. The first official case was on February 24th. 9 months later, on November 25th, we had recorded 50,000 cases. And since then, in just over a month's time, we recorded the next 50,000 cases. A grim reminder just how severe this second wave has been. Focusing on the last 24 hours, Alberta has reported more than 1,200 cases at the positivity rate of 8.7%. Active cases continue to drop in the Edmonton zone. We have just over 6,600 cases. For the first time, hospitalization numbers have surpassed 900. 152 of those patients are in the ICU, and sadly, 18 more Albertans have lost their lives to the virus. Field hospitals are being set up inside the U of A Butterdome. These photos were taken by the Canadian Red Cross. The organization has been working with AHS to set up the alternative care center. If necessary, it can accommodate up to 100 patients. In the event that it does get used, the beds would be mostly for patients recovering from COVID-19 who are at low risk of transmitting the virus. Alert is revealing more details of an Edmonton drug bust. Officers say thousands of dollars in drugs have been seized from a home in Castle Downs.